Good evening and welcome to ECISD Live. My name is Scott Muri and I'm the Superintendent of Ector County Independent School District. And it's a pleasure to have each of you with us this evening. We have a pretty incredible lineup of guests that are going to join us in just a few minutes that promises to be a really interesting and engaging conversation. But before we start that conversation, I want to provide just a few updates around ECISD and let you know some of the work that's happening and some things that you as parents may be interested in knowing. First of all, we started phase 3 of our reopening plan. That kicked off this week. We welcomed about 2,000 or 3,000 more students in a face-to-face environment. But next week on Tuesday, September the 8th, that's our final phase, phase 4. We will welcome our 4th and 5th graders to school, our 8th graders, and then finally our juniors and seniors will get to make their presence known on our campuses this year. And again, that's next Tuesday as well as Wednesday. It depends on students if you're an A day or a B day student. So for some, it'll be a Tuesday start and others a Wednesday start. But we are excited to welcome those students back. We anticipate that right now our data indicate that about 50% of our students have opted for completely virtual learning. So half of our kids are at home and will continue pre-K through 12th grade that learning experience. And the other 50% have chosen either a hybrid model or a full-time face-to-face. And that is what our current numbers indicate. However, parents, you have an opportunity. If you are interested in changing the modality of learning for your child, now is the time to make that decision. You'll be able to make that choice at the end of each grading period, as well as at the end of the phase-in period. And that's the period we're in right now. So we're getting ready to end our first phase-in period. So if you are interested in changing the learning modality, you may visit your son or daughter's campus website. And on each of those websites, you will find a form that you can complete. It's a digital form. It'll automatically be submitted to the school, and then you can transition from virtual to face-to-face, or you can go from hybrid to virtual. Whatever choice you wish to make, you'll have an opportunity to do that. Again, right now, those forms are available, so I encourage you, if you're interested in making that transition, to do so. The ECISD Child Nutrition Team had a really exciting announcement today for all of our virtual families. If your family is educating your kids at home as a part of the ECISD virtual program, and meals have been a problem for you, if getting out of your house every day to get the meals for your kids, if that is becoming a challenge, we now offer a home delivery service for our meals. So once a week, we would deliver 5 breakfasts and 5 lunches for each of the children in your family. If you're interested in that program, you may visit the ECISD website and locate the child nutrition area. You can fill out a form and let us know that you're interested in that home meal delivery service program, and we'll deliver your meals on a weekly basis. Again, breakfast and lunch for each of the student or the children that you have in your home. And I lift up our child nutrition department for creating that idea and then being able to implement that within ECISD. So a good opportunity to serve our families that have made that virtual option. And I'd also like to announce, as many of you know, last spring, we launched ECISD at-home TV. It featured many of our teachers and counselors and administrators and a lot of folks in and around ECISD providing content in all academic areas for our elementary, middle, and high school students. We are going to relaunch for the fall semester ECISD Live. Thanks to KOSA, we're able to broadcast on the CW 1 hour a day. Those days will be on Tuesdays and Thursdays from 1 o'clock to 2 o'clock. On Tuesdays from 1 to 2, we will feature elementary programming, so programming for pre-K through the 5th grade. And on Thursdays, our programming will be geared towards our middle school and high school students. All of the programming is created within ECISD, so we will feature our teachers, feature our counselors, feature a lot of the employees in ECISD as they work to generate that programming. First day is Tuesday, September 8th. Again, I invite you to join us on the CW. So thank you to KOSA for providing that channel at 1 o'clock on Tuesday, 1 o'clock on Thursday. Again, Tuesday's content, all driven towards our elementary kids, and Thursday for middle school and high school students. So we're excited to be able to provide that for you. All righty. We are going to now introduce our two very special guests. As all of us know, we are living in a pandemic situation, and it has really changed the way that we do business in every form of business, not only the way that we educate our children, but the way our businesses and our community are operating. The restaurant business has changed, but also the way that we are living our lives. We are now required to wear masks as we travel from place to place. We have to keep our hands very clean right now. We keep a distance from those that we are not familiar with. We maintain social distancing, and COVID-19 has really driven these new behaviors and these new opportunities for us. And tonight, we want to gain a better understanding of this disease and what it means in our community. We want to better understand what's happening in our community, how it impacts our children, our families, and then what the future may hold. What do we see coming in the days, weeks, months, and potentially years to come? So we've invited two very special guests tonight, both knowledgeable in this area, both also serving our community. First tonight, I'd like to welcome Dr. Benton. Dr. Benton is with Texas Tech Health Science Center. Dr. Benton also serves as the medical advisor for Ector County Independent School District. So Dr. Benton, welcome to ECISD Live. It's a pleasure to have you with us this evening.
Thank you, Dr. Muri. Thank you for inviting me. It's a pleasure to spend the evening with you and with parents and teachers. I'm a 26-year veteran of family medicine, a family medicine physician,
wow.
and currently practice and teach at Texas Tech University Health Sciences Center in Odessa, and as you mentioned, advisory to ECISD, and also working with the health department in Ector County. It's a pleasure to be with you, and thank you.
You're a busy man. Thank you for making time for us tonight. That's quite a list you have. Yep, we keep you busy. And in addition to Dr. Benton tonight, we welcome Dr. Sherman. Dr. Sherman is the Chief Medical Officer for Odessa Regional Medical Center, and has been very busy in the community as well, making sure that we all remain educated on this topic. So Dr. Sherman, thank you for joining us tonight.
Thank you for having me, Dr. Muri.
Well, Dr. Sherman, I get to know you. You actually, I think, were the impetus for a weekly meeting that we have. Why don't you tell folks about our weekly meeting and who kind of gathers together and the importance of that Wednesday morning at 8:30 meeting?
That's right. So having a weekly stakeholders meeting to discuss how COVID is affecting our community from different aspects, not just from a medical aspect, but from an educational aspect, economic aspect, public health aspect, and from overall city aspect. It's an important meeting for all those people to gather. So each one of those aspects that I mentioned, we have the leaders like the mayor and the superintendent of the school district. We have the CEOs and doctors from the hospitals, and we have the public health department. And we all get together every Wednesday morning at 8:30 to be sure that we are all on the same page and have the same information while we're making decisions for our institutions so that we can work together to curb this disease.
Yeah, good. So you mentioned the disease. Let's start with you, Dr. Sherman, and tell us a little bit in English, what is this disease and why has it caused such mayhem in our community, in our state, our nation, and our world?
Okay, so coronavirus is a type of virus that we have known about for a long time. And this specific version of the coronavirus is called SARS-CoV-2, SARS coronavirus 2, because the one was several years ago when it was in the Middle East. So this new virus, that's why we call it novel, because it's a new coronavirus to us as a scientific community, is causing a disease that primarily affects the respiratory system. So it's causing people problems with breathing. And that's kind of what we're seeing in the community now. So when we say COVID, it's coronavirus disease, COVID-19, because it started in end of 19 in China, which is when it first came about, and then it spread all over the world, and now all of us are dealing with this disease process. Hopefully, we have stabilized for now, and we'll see where this is going to go, and if we can get this completely eradicated like we did with the other disease processes we've taken care of in the past.
Good, good, good. Dr. Benton, we have been asked to do 3 things, and we've heard these as members of this community for several months now. We've been asked to maintain social distance. We've been asked to wash our hands frequently. And we've been asked to wear a mask. Why those 3 things? What do those things do to keep us safe?
Right. So this is a respiratory virus, right? It is acquired and passed from human to human, but our acquisition of that would be through our respiratory tract, through our nose and through our mouth. So covering our mouth and keeping our distance keeps the risk down for contracting this from another person. As far as washing our hands and good hand hygiene, if we touch a surface where the virus may be and then touch our nose or mouth, then we can spread the virus that way as well. So those are key to reducing the spread of this infection.
Dr. Benton, you are one of the things you mentioned at the beginning when you introduced yourself. You really supervise, or the physician that works with the health department closely. What are you paying attention to from a medical perspective? What data elements, what's important for you to look at so that you know the overall health of our community?
Yeah, so I think one of the key things is looking at hospital admissions and the burden of disease that's severe and causing hospital admissions. And then also even breaking that down as to where those hospital admissions are coming from. For example, are they people in the community, or are they people in congregated living centers like nursing homes? But even the unique thing that we have too is we are regional in Odessa. Our hospitals are regional, so we look at the numbers coming from outside of Ector County as well to give us some indication back. But the other thing is looking at the overall new positive case rate.
Mm-hmm.
I generally look at it on a weekly basis. Over the last 4 weeks, it's been about 200 to 250 new cases per week. So it has been flat, as opposed to a couple of months ago where we had a large surge. So that gives us some indication. Interesting, as that number has come down of positive new cases, the hospital rate has followed, hospital admissions. I think the other thing that we look at, but we have to interpret from the various data points that come in, is looking at the positivity rate. It gives us some idea of the burden or prevalence of the virus in the community.
Mm-hmm. Dr. Sarah Vannon, you're in the middle of the hospital. What do you pay attention to as the chief medical officer of the hospital?
Yeah, that's a very good question, because you have to understand, when we look at hospitalizations, what part of the disease burden in the community we're actually looking at. So a lot of people are going to get COVID-19, but out of the big pot of people that get COVID-19, there's a small pot that actually gets hospitalized. So if you have 100,000 population, let's say 50% get infected, 50,000 people get COVID-19. Out of the 50,000, maybe 10,000 people actually seek medical care. The rest of them don't even seek care, because maybe for half of them don't even know they have it because they're asymptomatic carriers, and the other half maybe have very, very mild symptoms that they can recover at home with all the precautions and isolating at home. So the small proportion of the people that actually seek care, let's say that's about 10,000, then you take a smaller proportion of that actually require acute hospitalization, so they're sick enough to be hospitalized. And even a smaller proportion of that will require ICU care, intensive care. And a smaller proportion of that will require ventilators. So we look at each one of those metrics. How many people in the community have it? how many people are in our hospital, how many people are in our ICU, how many people on ventilators. And that's the information we usually give out at our hospital press conferences too, because that's what helps us decide on the scale of how stressed we are as a health system and how much more capacity do we have before it gets to a point where we say, oh, this is going too fast, we need to slow down.
Have you seen the hospital stress, Dr. Saravanan, in the last several months at all?
So, Dr. Muri, in the last 3 to 4 months, if you look at it from end of March until now, there was a period of time right at the very beginning where this disease process did not really hit our community. And then there was a period of time where it started to rise very fast. And this was just about 3 or 4 weeks ago. We were very, very high with regard to the number of cases that were in the hospital. In fact, between both hospitals, we had almost 100 cases hospitalized. And that was a very stressful situation. Our hospital stress score was 70, 80%. You don't want to be there because then you're activating all your surge plans. You're using up all the extra resources that you have planned for. You don't want to be there. So now we're back down. In the last 2 to 3 weeks, we've seen it sort of come down and stabilize. I think all the education that we're providing to the community, all the precautions that are in place from the federal government, from the state government, from our local government with masks, those are helping. The education is helping, and we've reduced the overall disease burden in our hospitals over the last couple of weeks. So it's very encouraging.
Good. So, Dr. Benton, to you, again, it sounds like the hospitals have been stressed over the last several months. There's been a period of time. What about the health department? What does stress look like from a COVID-19 perspective at the health department?
Yeah, the time frame where that Dr. Saravanan was referencing, where we had that surge, right, where there were 100 in the hospital, then we were having high numbers of new cases each week. And that pushes demand, because one of the important things in managing a public health crisis or a pandemic is contact tracing, right? So when we identify a positive person, then we want to next identify the contacts of that positive person, the people who have had close exposure and would be at high risk of obtaining the disease themselves. And then those people we would like to quarantine to try to reduce further spread. So the numbers are 15 to 20 people are contacted by each positive. So that's a large burden of contacts and contact tracing that has to be done.
So we're seeing, Dr. Benton, some optimism right now in our community. What makes you feel fairly comfortable with what's happening today? What data elements, or just what are you seeing that makes you feel confident in what our community is doing?
I would like to commend the community, actually, because early on when this hit, everyone was talking about flattening the curve, and the curve has flattened, and that has to relate to the three things that you mentioned earlier of the hand washing, the distancing, and the masking. And so I think the community is paying attention, and we're all learning. As Dr. Saravanan said, lots of good information has come out. So to me, the encouraging thing is the cases are not surging again, and it has flattened, but I would like to see it continue to decline.
Sure. Yeah, absolutely. Dr. Saravanan, we ECISD started school on August 12th, and we welcomed back 4,200 employees. And on that day, we also brought in 4,200 students with us. What did you think would happen on that first day of school? What was your opinion about what school would create in our community?
Yeah, I mean, to be very honest, I was very worried about how that could affect our community. It was happening at a time when we had just tried to get control of this disease, and we were starting to stabilize. And then there was this event, big event, which is opening of schools happening. I didn't know which way it was going to go, But I was very reassured when I heard you speak at those Wednesday meetings about what the precautions were that we were going to be taking at school, with the masks and the face shields and the testing and the screening and the staging of how many people come back at what time. So when I heard those things, it helped me feel a little bit better knowing that we're taking every precaution we can. Because opening schools or not opening schools is a very, very difficult conversation to have. As a doctor, I want schools to be open. There's way more repercussions to schools not being open because it doesn't affect just the education of our kids. It affects socioeconomics. It affects parents. It affects there's adult-focused activities like job training and neighborhood meetings and parenting classes. There's physical and speech therapy. There's nutrition. There's emotional skills. There's safety. So there's way too many things that are affected by schools not being able to open. So that was not a big question in my mind. Is we needed to figure out how to open schools, not if to open schools, how to do it. And it was reassuring when you guys had those guidelines in place. And now we've seen that even though we've opened school, we've been able to keep that stability in our recovery process from this disease.
Yeah, no, absolutely. I think, again, we've had our first day of school, we reported, 2 cases. Our second day, we had a couple of cases, but, we from last Saturday through Tuesday, we had 0 cases each day. And now we're seeing 12,000 students face-to-face in our buildings. And I think that what our teachers are doing and our students and administrators is clearly working. I monitor your numbers very closely because, like Dr. Benton said, well, really both of you have talked about, we do not want to create a healthcare crisis in our community. We don't need our hospital numbers to skyrocket. We don't need our health department, to have to deal with the critical nature of what was happening a month ago. Talk about masks for a minute. Let's go back to you, Dr. Benton. One of the things that we require of all of our students, 4th grade through 10th grade, and all of our staff members is the wearing of a mask at all times. It's still a part of the governor's executive order, so we're required to do that. But even if that order went away, that's something we're going to continue to do as a district. So Dr. Benton, your thoughts on us continuing to require that of students and staff members?
I support that. The mask is, I believe, the key to protecting and preventing the spread. This is a respiratory virus. It is spread through our breath, through our talking, through sneezing, coughing, and the mask blocks a significant portion of that. It needs to be coupled with the social distancing to be even more effective, but the mask is the key, and I know in our circles and hospitals and clinics, we're wearing masks, and I believe we will continue to wear them for quite a long time until we see that this virus is cycling out of the community.
Yep. You mentioned, Dr. Sherman, and other protocols, things. What else, kind of should we maintain as a school district? What gives you confidence as a physician that the school district is doing this?
And the main ones were the masks, the face shields, the wiping down of surfaces, the screening of individuals, the education that's being provided to the staff, to the parents, to the students of what really to watch out for at home, the nurses being trained to identify and quickly isolate, the social distancing, the physical distancing that was planned in the school itself, and then the staged reentry. Rather than bringing everybody back and taking a chance, you bring back 25%, then 50%, then 75 and 100. And so that's what gave me the most level of confidence, the combination of all of those measures that we took.
Good. So a lot of our viewers are parents tonight, moms and dads supporting their kids. And both of you are practice family medicine. So you deal with not only the moms and the dads, but also the children within those families. Dr. Benton, as you talk to our moms and dads tonight, and as they're dealing with COVID-19 and perhaps they think a child might have a symptom or they're not sure what to do, what guidance would you give to moms and dads tonight that are questioning signs or symptoms that their kids may display?
That's a good question. And, I know these are hard times in maintaining some normalcy, and I would encourage us to try to maintain some normalcy and routines in our homes. Obviously, when we go out, it's mask and social distance, of course, too. The key to this is it's a respiratory infection. It's influenza-like illness or the flu.
Mm-hmm.
So those are the kind of symptoms that if your child begins to show those with nasal congestion, cough, respiratory tract, high fevers. One of the interesting things that's happening with this particular virus is loss of smell and loss of taste. So if they're having those kinds of symptoms, I would seek care. And the key is, well, of course, I would say family medicine, call your family doctor. But the key is contacting your primary care physician and following their advice, whether that be in Odessa Regional's clinics, Texas Tech's clinics, medical centers, ProCare clinics. All of them have physicians that are now well versed in this, and also those are places to acquire testing if needed.
Dr. Sherman, one of the things that if a child in school has been exposed, they meet the definition of exposure to the virus. Can you first tell us, what is exposure? Kind of what does that mean? And then if a child fits that definition, we send the child home for a period of 14 days. What should a parent do during that time? What should they watch for, et cetera?
So, yes, Dr. Muri, that is the right thing to do. Exposure is usually defined as being in the same physical space for 15 minutes or more with someone who is a known positive for COVID-19. 15 minutes or more in the same physical space with someone who has COVID-19. So if you have that, that's how the CDC defines it as exposure, then the best thing to do is 14 days of quarantining at home. And the reason we pick 14 is because there's something called an incubation period, the time from which you get exposed to a virus to the time when you can actually replicate and produce the virus, possibly get symptoms from the virus and become infective to other people. That can range anywhere from 2 days to 14 days. So we say 14 days of full quarantine mostly is good enough to get you out of that incubation period and therefore safely come back to the community.
Sure. Talk about one of the things we talked about earlier was the hand washing opportunity. And one of the safety precautions that we've taken is to limit those things at school that kids touch. We've eliminated a little bit of sharing. And we've talked about this. We teach our kindergartners how to share, except right now we're not quite sure we want them to share objects that do not belong to them. In your professional opinion, Dr. Sherman, we can stay with you with this one. Just how much should we pay attention to touch and spreading the virus through touching things?
So it's not to be discounted. What we do know for a fact is that the virus is a respiratory virus, which means it is mostly spread through respiratory droplets that usually come out of your mouth or your nose. So when you're talking, if you're singing, if you're playing, if you're sneezing, coughing, that's when these respiratory droplets come out of your nose and your mouth, and then somebody else inhales them, and that's how they get this virus. And that's, for the most part, how this virus spreads. It can spread from surfaces, which is why we have the cleaning protocols, which is why you guys have all these low-touch type of items or no-touch type of items. So yes, it can spread from surfaces because the same droplet that we're talking about can settle on a surface, and for a period of time, it will last on that surface. Different surfaces, different amounts of time. But if somebody else touches it and then touches their face, which our kids do all the time, that's how you can inhale it and get it. So it is good to keep those objects that used to be high touch points, at least low touch points, and those that remain high touch points, like doorknobs, etc., wiped down multiple times during the day to disinfect.
Dr. Benton, one of our parents has asked, and we've heard this question before about our playgrounds, staying on this touch opportunity. When we send kids out to a playground, they touch the slide, they touch the swing, and so your thoughts on playgrounds and kids and touch?
Yeah, that's a difficult environment to control. And, if you could clean repeatedly, then that would reduce the touch spread. But also in playgrounds, kids tend to congregate together, right? And then you go back to worrying about spread through respiratory droplets that Dr. Saravanan was just explaining. Yep. So, it's a harder environment to control. And, you would have to really be strict with that control in that environment.
Yeah, it's pretty tough. And we've talked about that, literally every time a child would go down the slide, we are now having to clean the slide so the next child could go down the slide. And it would create quite an opportunity for custodians, that's for sure, to keep those clean, those scenarios. Yeah.
So, Dr. Muri, early on in this disease process, one of the decisions the city had to make was about opening up swimming pools, and this was a wide discussion because do swimming pools help transmit COVID? Well, the true answer is a chlorinated swimming pool is going to kill the virus right away. It's not the swimming pool that's going to transfer COVID from person to person, but it's exactly what Dr. Benton was mentioning. The congregation of people around that swimming pool is probably what's going to cause the spread. And I think that's the same with playgrounds. Out in the Texas sun, I don't think this virus is going to last very long on those surfaces. Yeah. It's going to disinfect those surfaces very well, but it's the congregation and it's the time between when one person used it to the next person using it that we have to worry about.
Yeah, and that's again, doing everything we can to keep our kids safe and our numbers down. So let's play the long game for a minute. Dr. Benton, none of us tonight have the crystal ball, although right now I'd love to have it to figure out the future. But using, just based upon your own experiences and knowledge, what do you see happening the next month, 3 months, 6 months, year, as it relates in relation to COVID-19? Your best guess.
A crystal ball would be very nice. If you find one, I would share it with you.